Hello, my name is Eve, and today we'll be talking about Bell's palsy. Bell's palsy is a sudden, temporary weakness or paralysis of the muscle on one side of the face. It occurs when the facial nerve becomes inflamed, often triggered by a viral infection. Symptoms usually peak within 48 hours and typically resolve on their own within 2 weeks to 6 months. There is damage to cranial nerve 7, which is responsible for the sensation and movement of your face. When it becomes inflamed due to herpes or you could have a tumor, Lyme's disease can trigger this as well. And it pinches or cuts off blood circulation to that nerve or pinches the nerve directly. And it prevents signals from reaching your facial nerves, your muscles. So you'll have facial drooping, crooked smile. You won't be able to close your eye completely. You won't be able to raise your eyebrow on the affected side. You won't have wrinkles in the forehead on the affected side. Causes can be stroke. Now, when we say stroke is different from Bell's palsy. It's just when you have a stroke, you have weakness on one side of the face. It would kind of look like it's Bell's palsy. It's important to know that if you do experience Bell's palsy, that you go to your doctor to make sure it's not a stroke, because that facial weakness is similar to that of a stroke. So you don't want to mistake it for something else when it's a stroke, okay, which is emergency there. Hush. Each side of the brain handles the opposite side. For instance, the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. In Bell's palsy, signals from one side of the brain are not able to be sent to the opposite side of the face. This leads to the following. It leads to drooling on the affected side, an uneven smile, loss of nasolabial folds. So this wrinkle right here, it's going to be gone. Inability to puff the cheek on the affected side. You can't raise the eyebrow. Difficulty closing eye completely. We talked about that. And if you're not able to close your eye completely, it can get dried out and it can cause corneal ulcers, okay? So you want to preserve your eye. Make sure you're keeping it lubricated with saline drops, keeping it covered. Sometimes it's best to tape the eye down so that it can moisten the eye. You can lose sensation of 2/3 of your tongue on the affected side, so you won't be able to taste right. You won't be able to even chew on that side. So it's best to get soft foods, maybe changing the diet to a mechanical soft, because they're not going to be able to chew. You can have balance issues and hearing issues as well. Sometimes you can be sensitive to noise because that nerve, it runs all the way close to the ear and it's affected. Risk factors: diabetes. Diabetes causes plaque and it can cut off circulation of blood. All right. Hypertension, high blood pressure, that can cause problems. All right. Cause aneurysms, the bursts and things like that. Herpes simplex virus is the common cause. Mumps and Lyme disease. Bell's palsy begins suddenly. Y'all, and symptoms typically worsen over 48 to 72 hours. Early warning signs often include a slight fever, headache, dull pain behind the ear. This is quickly followed by rapidly developing muscle weakness or complete paralysis on one side of the face. Treatment include corticosteroids to reduce nerve inflammation, antivirals to fight herpes simplex virus. All right, this wraps up Bell palsy. I hope you learned something. If you get, it's temporary, it's temporary. It uh, lasts for a few weeks and to a few months. If it lasts longer than that, you need to go to your ear, nose, and throat specialist for further evaluation. I hope you learned something.